In today's video, we're going to talk about some early warning signs that could indicate liver damage. Knowing these signs is extremely important because it allows you to take action early and prevent the condition from getting worse. The liver is a powerful organ and has the ability to heal itself if it's properly cared for. According to statistics from the American Liver Foundation, about 25% of adults in the United States are affected by liver disease. Contrary to popular belief, excessive alcohol consumption is not the only cause of liver damage. Other factors such as eating too many processed foods, consuming excessive sugar and vegetable oils, overusing painkillers, and viral infections can also damage the liver. So, if you're wondering whether your liver might be struggling, make sure to watch this video until the end. We'll also talk about natural home remedies that can help cleanse the liver and prevent further damage. Number 1, pale stool. Pale stool can be an important sign of liver damage. When we eat, the liver produces bile to help digest food and fats. This bile gives stool its normal brown color. However, when the liver is damaged or fatty, the flow of bile through the bile ducts can be reduced or blocked. This causes the stool to become lighter, pale, or even clay-colored due to poor fat digestion. In some cases, stools may also float on the surface of the toilet water because of excess fat. If you notice these changes, don't ignore them. Consult a medical professional as soon as possible. Number 2, nyctalopia, poor night vision. Poor night vision, also known as nyctalopia, can be another sign of liver damage. This condition makes it difficult to see in low light or dark environments. One of the liver's responsibilities is filtering toxins and producing proteins, including retinol-binding protein, which helps transport vitamin A to the retina. When the liver is damaged, vitamin A levels can drop, affecting the cells in the retina that are responsible for night vision. If you're experiencing difficulty seeing at night, it's important to see a doctor as this may indicate liver damage. Number 3, swollen. Right foot liver damage can cause a condition known as peripheral edema, which involves swelling in the tissues, usually in the legs and feet. A damaged liver may not produce enough albumin, a protein that helps regulate fluid balance in the body. When albumin levels drop, fluid can accumulate in the lower extremities, leading to swollen feet, often more noticeable on the right side due to how blood circulates through the body. Before we continue, if you're finding this video helpful so far, make sure to subscribe to our channel so you never miss our latest videos. Number 4, white or yellow bumps around the eyelids. Another strange sign of liver damage is the appearance of white or yellowish bumps around the eyelids. These small lumps are cholesterol deposits called xanthelasma. When the liver isn't functioning properly, it may stop breaking down cholesterol efficiently. As a result, cholesterol starts to accumulate in different areas of the body, including the eyelids. Xanthelasma can be a sign of liver disease, so don't ignore it. Get your liver checked as soon as possible. Number 5, pressure on the right side. A feeling of pressure or discomfort on the right side of the rib cage, especially after eating, can be another warning sign of liver disease. When the liver is damaged, bile can become thick and sludgy, blocking the small ducts connected to the gallbladder. This buildup puts pressure on the ribs and may even affect the phrenic nerve, causing muscle tightness and pain in the right shoulder. Recognizing these sensations early can help you seek treatment before serious damage occurs. Number 6, purple or red bumps on the skin. Medical science shows that a damaged liver may not produce enough proteins like fibrinogen, which is essential for proper blood clotting. When this happens, you may bruise easily and more frequently. This can cause unusual purple or red spots or bumps to appear on the skin, often resembling a rash. These spots are commonly seen on the arms and lower legs and may also result from poor blood circulation, another sign of liver disease. Number 7, cracked heels. Cracked heels can also indicate liver damage. The body relies on vitamin B3, also known as niacin, to keep the skin strong, smooth, and moisturized. However, when the liver is damaged, it uses up stored vitamin B3 in an attempt to repair itself. This depletion can lead to dry, cracked skin, especially on the heels and soles of the feet. Don't overlook this sign, as it may point to an underlying liver problem. Number 8, white or swollen nails. White or swollen nails can signal serious liver damage or other health conditions that affect oxygen supply. A study conducted in the 1950s found that 8 out of 10 people with severe liver scarring had completely white nails, highlighting a strong connection between nail appearance and liver health. Another sign is clubbed nails, where the fingertips appear rounded and enlarged. This is often linked to chronic low oxygen levels, which can occur in liver diseases such as cirrhosis. Monitoring nail changes alongside other symptoms can help with early detection. Number 9, Dark urine. Dark yellow or brown urine can be a sign that the liver isn't functioning properly. The liver helps process bilirubin, a yellow pigment produced during the breakdown of red blood cells. When the liver is damaged, bilirubin may build up in the body instead of being filtered out, causing urine to darken. This can indicate liver conditions such as hepatitis, cirrhosis, or even liver cancer. Number 10, jaundice. Jaundice is a major symptom of fatty liver disease. It occurs when excess bilirubin builds up in the bloodstream. In a healthy liver, bilirubin is processed and eliminated efficiently. However, when the liver is overloaded with fat, this process slows down, causing bilirubin to accumulate. This leads to yellowing of the skin, eyes, and mucous membranes, which is the hallmark sign of jaundice. Number 11, spider veins. Spider veins, also called telangiectasias, are small, dilated blood vessels that appear close to the surface of the skin. They often form web-like patterns of red, blue, or purple lines and commonly appear on the face, legs, and feet. When the liver is damaged, estrogen levels can rise, increasing pressure in the veins and making them more visible. Spider veins may also indicate liver conditions such as cirrhosis or hepatitis. Number 12, itchy skin. Itchy skin is a common symptom of liver damage. This happens when bile acids build up under the skin because the liver isn't filtering them properly. This buildup causes histamines to accumulate in the blood, triggering an itchy sensation. It can also lead to dry, flaky skin, which makes the itching even worse. If you're experiencing several of these symptoms, it's important to see your doctor and get your liver examined, often through an ultrasound test. How can we reverse liver damage? Liver damage develops in 4 stages. It begins with fat accumulation in liver cells, followed by inflammation and the formation of scar tissue known as fibrosis. If this process continues, it can lead to permanent scarring called cirrhosis, which is the most dangerous stage and can result in liver failure. The good news is that the liver can heal and regenerate itself with the right diet and lifestyle changes. Let's go over the most important steps you can take to restore liver health. Step 1. Support the liver daily. Start your morning with organic coffee, but instead of sugar, add half a teaspoon of turmeric. The phytonutrients in turmeric and the polyphenols in coffee help reduce scar tissue and repair damage caused by alcohol, drugs, and fructose. Drinking at least 1 liter of water daily helps thin the blood and supports bile production. Include liver-cleansing herbs and spices such as ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, and cloves. Step 2. Eliminate inflammatory seed oils. To improve liver health, remove inflammatory seed oils from your diet. These include corn oil, cottonseed oil, canola oil, rapeseed oil, soy oil, margarine, and low-quality processed olive oil. Replace them with healthier fats such as butter, tallow, extra virgin olive oil, and coconut oil. These alternatives not only improve flavor but also protect the liver. Step 3. Eat sulfur-rich foods. Incorporate sulfur-rich foods like leafy greens, arugula, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasteurized eggs, oily fish, walnuts, onions, scallions, and broccoli sprouts. These foods increase glutathione levels, which helps detoxify the liver and remove fat. Sulfur supports toxin breakdown and improves overall liver function. Step 4. Cut out processed and sugary foods. To reverse liver damage, eliminate processed, sugary, starchy, and flour-based foods such as bread, biscuits, sweets, ketchup, pancakes, pasta, sodas, and similar items. A damaged liver reacts to fructose the same way it reacts to alcohol, so it's important to avoid fruit juices and alcohol completely. Step 5. Use bile supplements carefully. To reduce inflammation and cleanse fat deposits in the liver, purified bile supplements such as TUDCA, purified bile salts, or digestive enzymes containing ox bile can be helpful. These are most effective when taken in the morning on an empty stomach. Always consult a healthcare professional to determine what's appropriate for your specific needs. Step 6. Practice intermittent fasting. Intermittent fasting is an effective way to give your liver a break. It helps reduce liver fat, improve insulin sensitivity, lower inflammation, and activates the body's natural cleansing processes that remove toxins from the liver.